I had been struggling with some digestive issues. It just became so troublesome that I decided that I needed to get some answers as to what was going on before I had another baby. So after the colonoscopy and after I woke up in recovery, he came in and he put his hand on my shoulder and he said, "We found a huge tumor in your colon, and I've seen this a lot of times before and it looks like cancer." We were referred to Dr. Rashidi's office. We went there a week later.
I remember the day she came with her husband, this beautiful woman who was pregnant but so scared.
She just came into the room and sat down in front of us, and she pulled her chair right up to my knees, and she just had this calmness about her, and she just told us what they found, what the avenues and what the treatment should or could be, but also she was bold enough to tell me that it was a procedure that wasn't done very often.
Colorectal cancer is rising. It's one of the most common cancers we see. If you exclude skin cancer, it's the third most common cancer we see both in men and women in the United States. So it's high up there.
Making the decision to go through with the surgery, it happened on the way home from leaving Dr. Rashidi's office. My husband is my rock. He is my lens, my clear lens that I can see through. He gives me perspective that I don't think about. He said, "I support anything and any decision that you want to do. I'm backing you 100%. But who do you want to tell Wyatt the story of your cancer journey? Do you want to be able to tell him, or do you want me to have to tell him?" And that just hit home. I just pictured me not being able to be there and tell my child or see my child grow up because cancer got too overpowering in my body, that he lived, but I did not. So we called Dr. Rashidi back, I think the next day, and met again.
We needed to get the uterus out of the way, and we were afraid to injure the baby. In laparoscopic, sometimes we do hand assist surgery. That means the hand is inside and you do laparoscopic surgery.
So her surgical assistant, Callan, held Wyatt for the first time for 4 hours.
Her hand was inside Hannah's body while I was operating with instruments. It was a true team effort in the operating room between everybody. And when we talk about a team, the patient is actually the center of that team.
So life after we left the hospital, it was hard. I remember waking up from surgery and reaching down and filling that colostomy bag and just being so sad, and I'm so grateful that I woke up. I didn't know what life was gonna be like. I didn't know anything. I just had to trust the medical staff and the medical team could guide us one day at a time, one step at a time.
Team approach is the most important thing. There is this quote, you want to go fast, you go by yourself, but if you want to go far out there, you got to have that team. And I think in cancer journey, it's truly a multidisciplinary approach. It starts from the staff in your, office, then the physicians. So you have from, the primary care who's taking care of this patient, from other aspects. You have the gastroenterology who made the diagnosis. You have medical oncology and radiation oncology, the surgeon, the pathologist, a nurse navigator, which I think is super essential to making sure all of these things happen.
We walk a patient through their cancer journey. We bridge the gap for patients with their medical providers and their procedures, as well as their family and all of those pieces, trying to make sure that they are able to get to their appointments, they're able to schedule their appropriate procedures, appropriate treatments, appropriate scans, and all of those kinds of things. Donations to the MultiCare Health Foundation really support the ability for nurse navigators to provide resources to patients. The Helping Hands funds, the many different resources that they provided over the years, including adding to our navigation team, supporting our social worker team, supporting our nutritionist. All of those pieces are certainly important to reaching patients and allowing us as a navigator, when we see a concern for a patient, that we actually can hand them the resource. We can hand them off, walk them to the door of a social worker, or we can connect them and know that they're going to actually get called the next day to get support.
What I want the donors to know, this is a very special program. They're very invested people who are working and taking care of patients. It doesn't matter how big or small your program is, but you need to have the right people. If you have the right people and you have people who are passionate about what they do and care what about they do, you can achieve everything.
I'm so thankful that my whole family was taken so well care of and into consideration to live together for as long as God has in our plan.